Hello, my friends. Today is my tribute to Elizabeth Taylor. May she rest in peace. Who doesn't love Elizabeth Taylor? Now, my tribute to her isn't just because she was a beautiful, loving, and talented woman. It's because I believe that she lived and died with the effects of Ehlers-Danlos Syndrome. Now, as I've mentioned to you, 90% of Ehlers-Danlos patients are never diagnosed, and it is heartbreaking. I do not know everything about Miss Taylor's medical woes, but what I do know lines up with Ehlers-Danlos. Now, just to hit the highlights, she had somewhere between 30 and 40 major surgeries. This is not unusual for Ehlers-Danlos. My mom had 23 surgeries, and she had a very mild form of classic Ehlers-Danlos. Now, Miss Taylor fell off of a horse, injuring her back at age 12. Now, EDS doesn't cause you to fall off of horses, but it can cause poor healing that results in complications down the road. Later, she damaged her tailbone, which is very common in Ehlers-Danlos. I have to sit on a special pillow to prevent dislocation of my tailbone, especially on airplanes, as do many of my EDS friends. Now, she has had numerous disc replacements. Again, these could all be non-EDS conditions, so let's dig a little bit deeper. She was taken to the hospital at one point, weeping and clutching her head in pain. It was decided that she had irritation of the membranes covering the brain. She had numerous bouts with pneumonia and indeed showed indications of previous TB infection, which she never knew she had. Many EDS sufferers have poor immune systems. Now, in 1968, she was reportedly near death as she entered the hospital with severe back pain. No cause was ever disclosed, but it's important to remember that EDS patients tend to get early osteoporosis. This, combined with poor healing, can cause numerous complications with bone surgery, as you can only imagine. Now, this is a big one. Many EDS patients deal with heart abnormalities, bad valves and mitral valve prolapses, just to name a couple. Ms. Taylor had heart surgery for a leaky heart valve. EDS patients also have delayed healing and bleed easily. In 1970, Ms. Taylor had corrective surgery to stop internal bleeding 2 weeks after a gynecological procedure. This is a big red flag. Now, in 1994, Ms. Taylor had hip replacement with severe osteoarthritis. Then she had the other hip replaced. Okay, that happens to many people, right? But then she went back for another surgery because she was left with 2 different lengths in her legs. That is a little unusual. Now, Ms. Taylor had difficult pregnancies, which is very common with Ehlers-Danlos. In 1983, she was admitted to the Betty Ford Clinic for drug and alcohol abuse. She said that many of her problems stemmed from taking so many prescription medications. This is also very common in EDS, especially the hypermobility type of Ehlers-Danlos. Now, finally, Ms. Taylor died of congestive heart failure. Unfortunately, studies are showing that EDS patients tend to develop left ventricular diastolic dysfunction that goes on to full-blown congestive heart failure. I am working with a patient right now who is 23 with congestive heart failure. This is a big focus of my studies right now. EDS patients tend to have velvety soft skin that looks younger than its age, up through about the age of 60 or so, especially if we stay out of the sun. And we've all seen how Ms. Taylor's beauty continued throughout much of her life. Finally, we can't argue with her hypermobility. One joint that can be difficult to demonstrate hypermobility in is the elbow joint. With Ms. Taylor, no one can miss the hyperextension of her elbow in this picture. I'll attach. Dang it. Now, did her doctors know she likely had Ehlers-Danlos? We may never know. A skin biopsy would have diagnosed it, but it's almost better at this point not to know, so that we can all look to her for inspiration, how to live a full life filled with love and indeed passion, no matter what. Like many people who have gone down difficult roads, Ms. Taylor became an incredibly empathetic person, bonding with patients with chronic illness. For example, she was huge in the movement to help those with AIDS before it was cool to do that. She befriended Michael Jackson, who, understand I'm a huge fan of his, was a troubled man. So Ms. Taylor, I wear my boas today for you. And my friends, I wish you all the strength and love that she was able to demonstrate through her difficult health journey. So until next time, let's continue to inspire each other. Indeed, the stories of courage and selflessness that you have shared with me have been incredibly motivating for me. I know how many of you are turned away at doctors' offices, accused of being pain med addicts, or just plain crazy. I know how many doctors won't listen or empathize with your day-to-day suffering. Someday this will change, but let's start changing this world today, one brain cell at a time if we have to. I understand you and your journey. Please reach out to me as I reach out to you. We'll keep each other going, and when people ask you how you can be so sick but look so good, be sure to tell them, I have good genes. Gentle hugs to you all. I don't think I'm very good with boas. Okay. Sorry. This needs to be a little higher. Heck. Or maybe it's perfect. Hello, my friends. Today is my tribute to Elizabeth Taylor. May she rest in peace.